I want to welcome everybody that's tuning in today. This year's summit is the third annual, as was mentioned, but it is a little different. Mayor Bowser, obviously, we'd love to be joining you there at the convention center, but we are unfortunately virtual due to the pandemic, which is affecting so many aspects of American life and exposing inequities across our society, including as it pertains to maternal and infant health. This is also an issue that we at the 19th have been particularly focused on, and I will just invite everybody watching today to please read our coverage on this issue, which you can do by visiting 19thnews.org. Now, before we get started today, just a little bit of housekeeping. You can share today's conversation on social media by using the hashtag DC Maternal Health and by tagging @MomHealthDC and @Mayor Muriel Bowser. Now, with that, I want to dig into this important and timely conversation. And Mayor Bowser, I'm going to start with you because I know how important this issue is to you as both a leader and a Black woman in America. The issue of disparities in maternal health is finally getting more attention, which is a good thing, but it's important for people to have the facts, especially in a pandemic. So I just want to start by asking you, what is the state of maternal and infant health in the District of Columbia, and what are the challenges that remain as you see them?
Well, thank you for that question, and thank you for agreeing to host us. This is going to be our third maternal and infant health summit hosted in the district. We reached out over the course of these summits nationally to talk to national thinkers like yourself, doctors, moms, practitioners, lawmakers to be a part of this discussion. And this year we're doing it a little differently, but we'll still have over 6,000 people who have signed up to join us over the course of the next several days. I am in our convention center in Washington, D.C., and we're broadcasting to households all over our country to talk about the state of infant and maternal health in our country. And what we know is that the United States can and must do better. We do not compare favorably to our fellow world citizens and developed nations when it comes to how mom and babies do. And in our own city, while our real numbers are actually quite small, we still have too many women who die in childbirth or soon thereafter per 100,000 live births. So that is why we have been laser focused on how to change the trajectory for women's health and for mom's health and for the lives of their infants. And we know that it's more than a medical issue. It's an issue that has to do with how women fare in our city. It has to do with the institutions that we know have troubled paths. And it has to do with how we value making sure all of the things that make for healthy women and families are in place, including good nutrition, great housing, and access to high quality and culturally competent healthcare.
Yeah, such a good point you're making about the intersection of all of those things. It's not just a health issue, but it is tied to other societal issues that are disproportionately affecting women and of color, especially. And so with that, I want to turn to you, Dr. Maybank, and I want to ask you a little bit about the national scope of some of what Mayor Bowser talked about. What does the maternal health crisis still mean for women of color and particularly Black women, frankly, especially in this pandemic?
Absolutely. So first, thank you for this invitation on this panel. Thank you, Mayor Bowser, for the work that you've done. And also thank you, Congresswoman Kelly, as well, for the work and leadership that you have done over the years. And just really an honor to be here. So, as was already mentioned, the United States is we're doing kind of one of the worst in the world in terms of industrialized nations. We have about 700 moms and people who are doing birth or having birth pass away every single year. For Black and brown moms, and Black moms specifically, our death rates from maternal mortality are about anywhere from the range from 3 to 4 times higher compared to white moms. And if we go to other parts of the country, it can vary. I'm in New York City right now, and our rates have been anywhere from 8 times higher to 12 times higher. So it's a tremendous disparity that exists in our country. What is really, I think, key and critical now, and we're now in this time where people are calling and naming racism. I feel many folks are now understanding that racism is really the root cause of why these inequities exist, which means we get to shape and frame kind of the way in which we've created responsibility, or said who's responsible for this problem, right? And shifted away from Black people fully and Black birthing people, and look more so at our systems and structures that were already mentioned as it relates to where people can live and the types of jobs they can have and their opportunities to build wealth or not be able to build wealth, and whatever kind of healthcare and access that they may have as well. At the institutional level, though, it's always also really important to point out, and I'm at the American Medical Association. We have a membership of about 210,000 physicians, which is about a fifth of the physician population. And we work a lot with healthcare providers, and we're very clear the evidence shows that there is much bias that exists on the part of healthcare providers. It affects the quality of care that can be provided for Black birthing people. And it also affects, their perceptions of how they treat people. So we know that there are providers who have biases as it relates to pain and how they evaluate pain, as an example. We have studies that show that med students have these perceptions still that Black people have thicker skin, or that they have nerve endings that are different. And all of this influences how we are treated as Black people within the healthcare system. And what we ultimately know and really hear, and what the evidence shows and what the stories tell us, is we don't even need numbers for this, is that Black women are not being listened to. We have all the stories that are coming out on the news media about this, with popular and celebrities that are experiencing this as well. But this happens, on a daily basis. And we've learned now, there's even more recent evidence that shows that white doctors who are caring for Black babies, those Black babies are actually 3 times more likely to die in the hospital than the white newborns. That's recent data. And that's starking, and that we need to do something about it. But all of this, really comes together and creates stress for women. And we know that the evidence shows that these stressors impact our immune systems, they impact, our risk, and actually increase our risk of having babies earlier and at lower weights. And so now COVID's here. And what COVID really does, and I really wanted to highlight all of that first, because what COVID does is just exacerbate all of that. It is the same explanations, right? The similar structural issues, the similar provider issues as it relates to injustices. And there's just so much pressure on families, especially, for Black women who are usually holding many of their families together. We're in this unemployment crisis, and there are so many social inequities that are existing. And even, situations in which there are delays in testing, many folks don't realize this, impact essential workers' ability to go back to jobs. And many Black women are in what we call the frontline essential worker jobs. And it challenges their ability to find childcare and really put food on the table as well.
Yeah, that's such a good point. And yes, I mean, if someone like Serena Williams has to worry about, possibly dying in childbirth, what does that say for women, who are without her kind of resources or notoriety, right? Congresswoman Kelly, I want to come to you, because you are among the women, particularly in Congress at the federal level, who have tried to raise the alarm about this issue long before kind of the current moment that we find ourselves in. But it does feel like the public is at least more aware and responding to the maternal health crisis in this country. I wonder if you agree with that assessment, if that's something that you have kind of seen in your time in Congress as you continue to try to raise this issue. Is this something that you are seeing your constituents, other Americans, really more concerned about it? And how do you think we got there in terms of the level of awareness and concern around this issue finally?
First of all, I want to say greetings to everyone. Greetings, Mayor. It's good to be with you, Doc, and thanks for your kind words. I really appreciate it. And I bring you greetings from Karen Bass, the chair of the Congressional Black Caucus also. I do think the public is a lot more aware because of celebrities that it's happened to. People can't believe, because of what you said, their resources, that they actually go through the same thing also. And I give Judge Hatchett and her son a lot of credit, because he's gone all over the country. And actually, we did something with him about 3 years ago in Washington, D.C. I didn't realize myself what an issue that it really is, that it was safer for me to actually have my daughter than it is for my daughter, who hasn't had a baby yet, to have a baby. And so I just think, because the light is really being shown on it, that's why more and more people know about it. And some states are trying to step up to the plate. In Illinois, Black mothers are dying at 6 to 1 times the rate of white moms, and the state legislature they're shining light on it and trying to do something about it. I think it goes back to, we say the social determinants of health. I say the social determinants of life, actually, lack of access, housing, the education where you work, and on and on and on. And just the systemic racism that has continued. The other thing is, it's been proven over and over that you do better when it's someone that looks like you treating you, or at least understands the realities of your situation. So we have to diversify the healthcare pipeline, not just doctors, but in a lot of different fields in healthcare.
Yeah. Yeah, and just to your point, those social determinants of life are the things that have been, the inequalities of those have been laid bare in this pandemic. And I think, that is why this issue in this moment has become critically important. I want to stick with you for a second, Congresswoman Kelly, to ask you, and then I want to also go to Mayor Bowser after this, to talk, if I can hear from both of you, about how citizens and voters really who are now concerned about this issue can get involved at both the local and federal level. What advice would you have for folks who are wanting to know, I care about this issue, what can I do?
Well, I will tell you, I had, or still have it, a bill called the Mamas Act, and not to be partisan, because I work in a very, very bipartisan way, but I couldn't get one of my colleagues on the other side of the aisle to sign on to the bill, even though they represented states that were 1, 2, and 3 in maternal mortality issues. So I'm going to say, call, write, email your congressperson, your house person, or your senator. Of course, that's one great way to do it. Let them know that you're listening, you're looking. Also, the other thing is, talk to your doctors about it. Also, let them know that you're, listening and looking, and you're advocating. But I think making our voices heard is the best thing to do. Also, the other thing I'm going to say, and I know the mayor will like this, to fill out the census, because money that goes to programs in your area based on how many people we think live there. And COVID has exacerbated the need for more resources around health. And so if people want more resources in their area, please fill out the census. That's something else you can do beside vote.
And I would add to that, and thank you, Congresswoman. The census is very important, and we're pushing for everybody. A lot of cities, including ours, are experiencing lower levels of response, COVID, distraction, you name it. And so we want everybody to answer the phone, go online, mail in the form, so that we can be counted. And more than that, I would say, I want everybody in America to have access to high quality health care. And we're still fighting to keep the protections that the Affordable Care Act offers in so many jurisdictions. We feel very privileged in our city. We've invested heavily so that over 90% of our people have health insurance. And we want to make sure that they're using it, that they're going for well women checkups, prenatal visits, after after birth visits, that they're getting vaccinations, and that they are going and finding the care and the provider that works for them. And what we have found is that people are more likely to go to a doctor, a provider in their own communities, a person that they trust, that are part of a trusted network. That's why it's been so important for us to invest in these federally qualified health centers throughout Washington, D.C. It's also important that that's one part of our integrated network, but that we have specialty maternal care as well for so many of our women who are in more complicated pregnancies. We need those specialists and hospital care close to them. That's why this year, even amid the pandemic, we're very proud to have crafted an agreement that's going to get 2 new hospitals in Washington, D.C. over the next several years. One in Ward 8 that's going to serve women who have been underserved by this specialty care. And we're also investing in an agreement with Howard University that's going to allow them to rebuild their hospital, secure the future of their medical school, and train more African American doctors. So all of those things we know will be a great benefit for our voters. And when we go around Washington, D.C., people care about healthcare. They care about geographic distribution of those resources. And one thing voters can do is hire more women, because we know when women and our male allies know the importance of this issue, it stays on the agenda.
Yeah. Tying this to voting in the census, I appreciate you doing that, because not everybody may make that connection necessarily. Dr. Maybeck, I want to come back to you because we know that COVID has put immense pressure on our nation's healthcare system, as the mayor was just saying. I want to talk to you about what you've seen in terms of how COVID is exposing gaps in our healthcare service delivery.
Yes, thanks. And I'm going to come back to voting as well, because I think it's really important from the healthcare provider, but I'll first talk about the healthcare system. You know, what I think COVID really has shown is that we have a long way to go to center equity. So as I hear the mayor, you know, talking about opening hospitals, I think that's great. And I think as those hospitals open, and this is anywhere in healthcare institutions open and work to strengthen their systems, they have to be very intentional about centering equity. Equity doesn't happen, you know, it doesn't just happen. We all know that. And we have to fight for that and be very intentional about that. Because what will happen is that even with good intention, if the systems are not set up to be equitable, if the processes, if the quality within that system or the structure of the healthcare system, it is going to revert back to the cultural norm, the dominant norm that ends up not valuing Black and brown bodies and causing the violence and harm that we are really trying to work to prevent. You know, as was already mentioned, significant impact in terms of the lack of insurance and inadequate coverage at this time in many different ways in different parts of the country. There have been closures of hospitals. And oftentimes, you know, I think there's been more focus on, as Congresswoman Kelly called, the social determinants of life, or the social, I don't know if I'm saying that right, the social determinants of life, yes. Is that our healthcare system really fully can't even adequately address social needs in the ways that we really need it to do. Oftentimes, and historically, it's really been about, you know, the healthcare service itself, the doctor's office, the hospital, but not enough connection and context to helping to support all these other areas of life that we know need support. And it really, if the healthcare system doesn't evolve to do that and do that in more meaningful ways, it's, you know, who else is going to do it? And I think something that I've really noticed, you know, I was in public health and governmental public health for a long time as deputy commissioner in the New York City Department of Health, and now really coming into this public health or healthcare space. And one of the big, I think, challenges that's in our country is kind of this divide between our public health system and our healthcare system. And this is really important, I feel, on a policy level, but on a practical level. Our public health system has been completely exposed in a way it hasn't. It's more visible than it has ever been. And folks are understanding this larger context of what creates health and the importance of public health systems, but they're so underfunded. They're very well organized. You know, we just relaunched last week the 10 essential public health services that were started 25 years ago that tells us all the things in the roadmap that we need to put forward for public health, but it's so undervalued and so underfunded. And we in public health and healthcare need to come better together. And I think that is an opportunity that we need to capitalize on. I think opportunities also as it relates to, you know, training, even though I'm a believer that training is not sufficient enough, but it is important in terms of in anti-racism training, structural competence training. Some folks refer to cultural competence training, but all these are very important in order to support and build our systems and our healthcare system so they're operating in much better ways.
Yeah. You know, I want to. You talked a little bit about what needs to happen internally. I want to ask you too about externally and how challenging the role of kind of getting timely and accurate healthcare information when faced with a global pandemic, particularly for pregnant people, right?
Yes.
What are the challenges of that? And for people who don't understand, I mean, why is that? Why it matters?
Well, I think it matters if we think about it for, you know, ourselves, you know, important and accurate, timely information helps us have some power over responding for our own health, power for ourselves, power for our families, power for our loved ones. And it is a primary function, again, of public health, but if we don't have it, if we don't have it in a timely manner, it's really hard to respond. It's really hard to have a sense of security during a time that it's really hard to have a sense of security. And so the more information that we have, the faster that we have it, the more honest and transparent that we have it, because sometimes information is not known. COVID is a great example of that. There's a lot we still don't know and understand about COVID, but communicate that, you know, and communicate those parts in an honest and transparent way is very helpful. Having communication that's in languages, different languages is very important. We are not homogeneous as Black folks. And so we need to have different types of ways of hearing information. I think also, you know, what's happening is this realization, and I know the mayor as well as Congresswoman really understand the importance and value of trusted messengers to deliver those messages and credible messengers. Within our communities, you know, as we do this forward, and not just to deliver the message, but also to give us feedback as at institutions like myself, you know, being at the American Medical Association or when I was at the health department, that we get feedback to make sure that the messages that we're putting out or even make sense or they translate, and that they're nuanced, you know, enough. COVID, you know, when our initial kind of stay-at-home message came out, it wasn't nuanced enough for folks, especially folks who are essential workers. You know, what do they do, you know, when they have to care for people and they have to go to work? So we have to work on these communication pathways. And then in terms of credible, you know, message and kind of trusted information, you know, that's obviously has been a challenge. You know, I'm very kind of vocal about that. And, you know, we at the AMA, we've worked really hard for our providers, definitely to make sure that we are rapidly putting out information for the providers that are trusted. We've built lots of partnerships and relationships in ways that we had not had that before. So we work with other physician associations to make sure that we're exchanging information. Is this what you're learning? As you know, this is what we're learning, and putting that out there. And then we're also centering voices of physicians who are oftentimes racially marginalized, who we haven't heard from as often in the past, who have a whole different experience sometimes in context, because they are seeing oftentimes people of color and women of color.
Yeah, Errin, I think that Dr. Maybeck makes a very interesting point that we learned during COVID about the stay-at-home order being nuanced, because we had to come back and make it very clear. We don't want you to stay at home if you need to go to the doctor because you feel like you're having a heart attack,
right,
or you're having other symptoms that require emergency attention. We don't want you to stay at home and not go to your prenatal visits, or perhaps you can do it on telehealth, but you need to learn how to connect via telehealth. We don't want you to stay at home when your infant needs her 6-month visit, or that vaccine that comes at 12 months or 2 years.
Yep.
So all of those messages, I think we've learned a lot in the COVID environment. Our hospitals learned a lot by saying, yes, we want to make sure we have a sterile environment, but we're okay. We're doing all of the things that we're supposed to do. We have the PPE, and it's safe for you to come in for treatment. Our doctor, Dr. Nesbitt, likes to remind us that all of those ailments and illnesses that existed before COVID that we require you to go to the doctor, they still exist. And our healthcare system has worked very, very hard to be safe and ready for everything. I think that Dr. Maybeck also made a great point when you asked what voters need to be doing. And even for me, who's been in local government a long time, I'm seeing our public health system in a whole different light, and how ready and prepared they were for a pandemic. We always in local government prepare for the worst and hope it never happens, but we are experiencing something that our local officials and doctors have been preparing for, and they're doing a heck of a job. But we see what the things that we're missing. Stocking up on supplies, having those messages ready, making sure we can hit go on some very important messages that keep our community safe. And also what we learned is what the interaction with something like shutting down your economy, sending kids home from school, where they have school nurses, where we have the ability to keep an eye on if they're safe and healthy. We've lost a major avenue to do that with kids not being at school. And so we are just learning a lot of lessons about how public health intersects with our local economy and our economic development efforts, with our public school system, and with other aspects of public safety. So all of these things are going to be lessons learned when we look back, when we built back to a more normal place. We're going to look back and have learned a lot about how our public health touches so many aspects of local government and the way we live.
Right.
And if I can just say, I think that the importance of community health workers has really had a light shown on it, because in one of my districts, which is one of the worst in the Chicagoland area, that's what has helped them they already had a few community healthcare workers that went out into the community, but that's helped them get the neighbors into the health center for testing and things like that. So I think we're going to see a growing field around that. And also, I just wanted to give a shout out to DC, because you also have to put up with people coming in and out of your city every week from all over the place. You know, I'm one of those people.
We don't call it putting up with Congressman. We welcome you safely.
Well, you've done a great job. I just want to say that also.
And just can I build on one other thing that Congresswoman Kelly just mentioned? What is happening during this time is that we are seeing an increased demand for birthing support from doulas across the country. And, you know, I'm of a physician organization, and most physician associations definitely recommend, you know, for births and birthing to happen within the context of healthcare institution and in hospital. But we're very clear, and the evidence does show that support from doulas and birthing coaches do help Black women especially, and especially when they come from our communities, and they help support in these times of just asking questions, but also support in helping to advocate as well. So I feel as well, in addition to community health workers, you know, there's kind of this broadening of also supports around birthing that's also happening. And then the other piece, you know, in Chicago, you know, Congresswoman Kelly, AMA headquarters is located there. And so we've been working very closely with Westside United. And, you know, it's a community kind of infrastructure. And I would imagine, Mayor, that you have the same situation in DC that was set up before COVID even came around, right? And then having the opportunity to kind of capitalize on that community strength and assets in order to respond rapidly, I think has been really useful in many cities across the country as well.
Yes.
I love what you're saying there, Dr. Maybank, because yes, I think that what we are learning here in this maternal health crisis is that Black women need all the help they can get, right? In terms of having that having advocates, for them to counteract some of the disparate treatment that they are getting in this process. Mayor Bowser, I want to come back to you as we kind of start to look ahead and think about some of those lessons learned that you mentioned. So with all that we know is at stake here, what can you talk about what steps the district has taken to really improve perinatal health outcomes, and in what ways residents are kind of tangibly experiencing those efforts?
Well, thank you for that, Errin. We've talked a little bit about it, but one, we take very seriously our national voice. We host this conference at the same time as the Congressional Black Caucus's legislative meeting, and we do that purposely so that we can invite Congress people like Congresswoman Kelly to come, because they have a huge role to play in moving the national agenda. After our first summit, we created Thrive by Five, which is an executive office in the mayor's office whose purpose is to coordinate among all of our agencies that touch women and kids and make sure that they have the budget resources they need, they're moving the legislative agenda that we need to get done as well. Our Department of Health, led by Dr. Nesbitt, who taped a greeting for earlier, has also drilled in our heads that we have to talk about before birth, during birth, and after birth, and focus on well women. And well women have healthier birth outcomes, and focus on that whole continuum of care that are serving moms and babies. And finally, we are very focused on what I said, an integrated system of care that includes local trusted messengers and providers, all the way up to specialized maternal care and hospitals filling the gaps where we have them in our underserved communities. Our partnership with Howard University will include, and I know Dr. Frederick is going to be on a little bit later, will include a center of excellence, and in fact, 6 centers of excellence, but one of them will be focused on maternal care, where we have the opportunity to have some rich research on all of the things that are impacting the health outcomes of Black women.
That's great. Congresswoman Kelly, I want to come to you. You mentioned the legislation that you have around maternal health. I want you to tell folks a little bit more about that legislation and kind of where it stands now, but also just talking about in this pandemic, address, what you are trying to do to help address some of these disparities around COVID and minority communities, including around the issue of maternal health.
Sure. Well, the legislation, the first one was the Mamas Act, and it was a comprehensive piece of legislation that dealt with different aspects of maternal mortality and morbidity, looking at best practices. Why does it happen more in some places than other places? Establishing a review committee. Something Dr. Maybank said, I don't like this word, cultural competency, but you get the idea, what we're trying to say, to extend Medicaid to 1 year instead of just 2 months after having a baby. 70% of women do have some issue mentally or physically, and oftentimes it's after the 2-month period, and at least half, if not 60% of babies born, Medicaid is used. So we took that part of the Mamas Act and put it into the Helping Moms Act, and that actually was included in something Nancy Pelosi did. So that passed out of the House. But as I said, prior to that, I could not get one of my colleagues on the other side to be a part of the Mamas Act, but they did help with the Helping Moms Act, and that's extending Medicaid to 1 year. We would incentivize the states to do that, and they wouldn't have to get a waiver from HHS. So hopefully one doesn't pass the other, but we're still working on the other one. And I know you asked me, what are we doing now? I'm the chair of the Congressional Black Caucus Health Brain Trust, but I'm also on Energy and Commerce on the Health Subcommittee. And actually, Congresswoman Maybeck Clark and I actually started a racial disparities working group from Energy and Commerce. We thought we were just working on health, but then we were told, no, don't just work on health, work on the environment, work on energy, all the ways where there are racial disparities. And as was said already, it's just a system of racism that we face. So we're trying to knock down, all of those walls. But there's different pieces of legislation that myself and other members of Congress have to really deal I won't say once and for all with the racial disparities. We know we can't snap our fingers and that it'll go away overnight, but there are different bills in the hopper. And again, we know that those bills may not go anywhere before November 3rd. So many bills are hung up, in the Senate or Mitch McConnell's desk, but perhaps, who knows? We have a shot in January to face down some of these issues of racial disparities. And there's so many, yes, we know about healthcare, but again, the social determinants of life are all a part of it also.
Yeah. Yeah. Well, as the mayor mentioned, we certainly would have been all in Washington together for CBC this week. So definitely want to talk about legislation and policy in this conversation. Dr. Maybank, the Congresswoman mentioned racial disparities, and we know that there are racial disparities in COVID and with respect to maternal health. There isn't much data on pregnancy and coronavirus, but we do know that pregnant women are more vulnerable to severe cases of the virus. And I'm wondering if you can talk kind of about what that, why that is, and the need for more data around pregnancy and COVID.
Yes. So yes, thanks for the question. So what we do know, so far, and this is really from the CDC's information, is that there are about 20,000 or so cases COVID cases among pregnant women from the time of January up until about last week, and about 44 deaths. When you look at the race and ethnicity data, so far what they have, are the highest rates are among Latinx people, then whites, and then Blacks. However, the important thing to note also is that this data is not complete. And this is the challenge of data collection really across the country, that we don't have enough data about pregnant women just in general, because that's just not being collected, and COVID tests aren't done on everyone as well. And we know that our systems to collect race and ethnicity data are quite lacking still across the country. And we've been working with Congresswoman Kelly's office, Mia Keys, who is at the Center for Health Equity, has worked with Congresswoman Kelly in the past, has really been a strong advocate to make sure that we as AMA are really using our voice in this space to strongly advocate that we need better systems, we need better data. If folks aren't counted, we cannot tell exactly what is happening, and it's really critical in a new and novel virus such as corona. What we do know, that pregnant women who do have COVID, that they tend to be, if they get sick from COVID, they tend to be more likely to be hospitalized, as well as an increased risk for intensive care unit admissions, as you already mentioned. No difference so far that we're seeing in deaths between non-pregnant women and pregnant women in terms of COVID. And the severity of it, why? We still fully don't know, because we still fully don't know enough about COVID. But possibly, an immune system related changes, the things that really trigger and create the severity for COVID in a non-pregnant person is the same thing that would happen really in an individual that is pregnant as well. So there's a lot to be learned so far. What we do know is that when a woman does become severely ill with COVID, and if she does, she's definitely at an increased risk of having an early delivery or birth, or at increased risk of a fetal death. So it's very serious and very important that we watch. But again, there's still not enough data. We need more data. We need more accountability to data in policy across this country.
Yeah.
If I just jump in that that was one of the issues that we saw. So we passed legislation that the president actually signed to get more and more accurate racial data from the CDC. They did not do a good job with their first try at it. They just had 3 pages of links for people to go to. But we wanted to know who got sick, what age, what race. If you were sick, did you go to the ICU or were you sent home, and all of those things we were trying to find out. But the problem is also a lot of the states don't have the same recording mechanisms or don't even record, or they have 2 different systems. So we have to look at putting resources together so that everyone is operating, from the same system.
Yeah. And I will just add from my newsroom, I mean, we've been completely frustrated by the lack of information around gender, period, around the pandemic, both from the public health and the economic, crises. I want to close our conversation with a question that I'm going to put to all of you, and that is, well, actually, it's a 2-part. So one takeaway from this pandemic that you would say we could use to improve outcomes for pregnant people and babies. And then the other part of it is kind of, where do we go from here? What encourages you, and what also continues to kind of frustrate you about where we are in this conversation? We can start with Congresswoman Kelly.
I think just the numbers of people that have died. I mean, it's just unbelievable. And what's frustrating to me, and of course, I'm not just talking about pregnant people, but if we would have done more sooner. I know we didn't know everything about this is a novel virus, but I think, we could have prevented, some of the deaths. And what frustrates me now, that I feel as a member of Congress, we're trying, but we could be doing more, to help people. And I'm saying that as a person that lost a family member to COVID. We had no idea, that my uncle had it, no idea at all. He went to a church with 60 members, a small church, and 16 died from COVID. And they followed, they closed the church and they were supposed to, and all of that. But what gives me hope are people like Dr. Fauci, our organizations like the AMA, like things we're trying to put together, in Congress, and seeing places that were so ravished, I guess, like the New York, like the New Jersey, and seeing that if you follow what the doctors and the scientists say, that there is hope. We can get, past this.
Yeah. Dr. Maybank, I'll come to you next.
Yes, I think a couple of things. I think the strength and persistence of racism and white supremacy to really hold these fractured and dysfunctional systems in place is something that becomes just more and more obvious. And it becomes obvious because there have been women and Black women who have been leading this call for a very long time. Black Mamas Matter Alliance and the National Birth Equity Collaborative, Joy Career and Monica McLemore and many other Sister Song, who have been saying, we need to listen to Black women. It's not new. And I can see that relative to now to kind of the strength and persistence of racism and what we need to do when we're larger organizations and powerful organizations like AMA, and how we really need to use our voice in support of and in advocacy as it relates to supporting Black women and saying that this is not right, it's unjust, and all of these things are absolutely preventable. And I think that is a role that we have to move forward even more and really also start advocating for those policies that are more about, the social determinants of life and moving more upstream as it relates to, universal health care, however that is achieved, things related to paid family leave, absolutely critical. And I think our overall, narrative in this country needs to be more rooted in, a human rights value, and that health is a right that everyone deserves, so that they can have access and they can have the opportunity to have the power, the resources, and the conditions to achieve optimal health. I feel like that's the direction we need to go and where the hope is going to lie. And it's going to lie in all of us, coming together and continuing our multi-sectoral work that we know is absolutely critical to achieve collective outcomes and impact.
Yeah, Mayor Bowser, I'm going to come to you last, but I also want to ask, with the district being a sanctuary city, the issue of how maternal health and COVID is affecting immigrant moms where you are. If you could address that too, in talking about kind of where we go from here and the hope and challenges that you have, and also your takeaway for how we can improve outcomes around this issue in this pandemic.
I appreciate you asking that question. And you might notice that I have on two flags today. One is our flag, the American flag, and one is that of El Salvador. And we are sister cities to San Salvador, and we have a great number of Salvadoran residents in Washington, D.C. Today is their Independence Day, but it is also the day where many of them are waking up very scared of their futures because they're protected by the temporary protective status that the Supreme Court has further called to question in the Trump administration's actions. So we are thinking about them and other communities, Guatemala, Haitian communities that have the TPS currently and are worried about their future. We in our city want every immigrant, all of our residents to know that our local government serves them too. And we have really been in the forefront of providing health care, managed health care to all of our residents, regardless of their status. So we want to continue to do that. But our job, even though we have great healthcare and great access, is made harder when they fear the government. And they may not distinguish between, down the street and their local government. And so we just continue to call out to people that your kids can go to school, you can go get emergency care, and you can get regular care because you can get insurance in Washington, D.C. So our D.C. residents and taxpayers have invested in that, and it is one of our values as D.C. residents. But you raised earlier and highlighted that more Black and brown people are getting this virus and dying from this virus. That is our experience here in DC, where we have over 70% of fatalities related to COVID are African Americans, where we see the rate of infection is higher among our Latino population. But what we're also saying when we say those numbers is that more Black and brown people are in essential work and can't stay at home and can't always protect themselves from exposure. And so how we come out of COVID is certainly a health issue, but we come back better from COVID if we have more equal access to good paying jobs and good food, and more people are on a trajectory to be able to afford a great quality of life in DC. So that's what we keep our focus on. I'm very optimistic about what we're learning about people getting access to healthcare in different ways. COVID has also exposed the lack of internet access that divides cities and divides the United States. And I'm looking at my sister, Congresswoman Kelly, and saying, please, in the COVID response, make sure that we're dealing with how to close the digital divide in our country, because we know not only is that affecting schooling, it can have, in my view, a tremendous impact on people being better connected to healthcare providers and following their health as well. We're taking some steps here in DC of connecting our kids to the internet, but we know that we can also strengthen the infrastructure of our cities. And in doing that, you attract investment and you put people to work, which is going to help us come back better from COVID. So all of those things we're thinking about as we try to get our kids back to school, get our downtowns open, get people back to work, and bring our economy back.
Yeah.
If I can
We're almost out of time, but I know Congresswoman Kelly, they're calling votes. So can you skip us or do you need to leave us?
I need to leave. I just want the mayor to know that we have a bill, the Moving Forward Act, that deals with infrastructure, and it's the infrastructure, roads and bridges, but it's also the hospitals, healthcare, broadband. I have a part of
all of those things.
Yeah, education. 40% of the people can't get online because they don't have the broadband capacity. So that hurts my other area of interest, telemedicine. So I'm with you. And yes, if you don't mind, I need to scoot.
We certainly understand you have a job to do. Dr. Maybank and Mayor Bowser, are you with me? And thank you, Congresswoman Kelly, for joining this conversation.
Thank you. Thank you.
Errin. Thanks, Doc.
Mayor Bowser, I'm glad that you mentioned El Salvador today, the start of National Hispanic Heritage Month. And so, that is certainly important. And you also talked about the reopening. And I know we had a question, pertaining to that with the issue of early learning and development, which is also critical. So can you just speak to the commitment to quality childcare and support for babies as critical connections to the health of babies?
Well, absolutely. And we are incredibly invested in early child care in DC. And I guess now for more than 5 years, we've had universal pre-K in Washington. So children 3 years old can go to school, go to our public schools in Washington, DC, which is a huge benefit, not just for their parents, but we think for their lifetime of learning. We also know, though, that high quality childcare and affordable childcare is very important to how we attract and keep parents in DC. And it's also been highlighted during this COVID process. For example, in the early stages of COVID, we shut down just about all of our childcare centers and had to open emergency centers for our healthcare workers and essential workers. And bringing those childcare facilities back in a safe way where there's PPE and there's testing and there's social distancing is also going to be critical to bringing everybody else back. And we're very focused on how to get kids back in school in DC now. And we're hopeful that our residents and businesses will keep doing all of the right things that keep this virus contained in our city so that by the first part of November, we will have hybrid in-person learning.
Yeah, we absolutely are all hopeful for that. Well, listen, I want to thank our panelists. This has been a robust conversation, very informative, very insightful. And I want to thank everybody who tuned in today and just remind you all to please stay safe and healthy. Remember to wear a mask, remember to take precautions to protect yourself in what is for now our new normal. Have a great afternoon, everybody.
Thank you.
Thank you. Bye.